Hello, my name is Alicia. I'm your nurse today. I'll be taking care of you. How are you?
Good.
Okay. I am going to provide hand hygiene, and I'm also going to provide my patient with some privacy. Can you please verify your name and date of birth?
Elijah Spencer, 11/13/2005.
Okay, great. And do you know where you are today?
And the doctor's office.
Okay. And what month and year are we in?
May 2022.
Okay. And who is our president?
Joe Biden.
Okay. Patient is alert and oriented. Speech is clear. Posture is relaxed. Hygiene is good. I am going to be performing a head-to-toe assessment on you today. Okay, and I'm going to start off by inspecting your head. Okay, did you feel any pain or tenderness?
No.
Okay, patient denies pain and tenderness. There's no bumps, bruises, lesions, parasites noted. Hair is distributed evenly and appropriate for age. Can you please smile? Can you puff your cheeks? Can you frown? Okay. Can you close your eyes? And can you please let me know when you feel? Okay. What side?
Left.
Okay. What side?
Right.
Okay. Can you... The trigeminal and the facial cranial nerves are intact. No abnormalities noted. Now I'm going to assess your eyes, okay? I'm going to put have you look at me, and I am going to check your eyes. Can you open them? Thank you. Okay. All right. Pupils are equal, round, and reactive to light, and they accommodate. Mucous membranes are pink and moist. No abnormalities noted. No drainage. Now I am going to have you say ah. Okay. Can you stick your tongue out for me, please? Okay. Can you lift it up to the roof of your mouth? Thank you. Can you move it from side to side? Okay. So the hypoglossal, the vagus, and the glossopharyngeal cranial nerves are intact. The mucous membranes are pink and moist. No abnormalities noted. Can I have you cover your left eye with your left hand? Okay. Please let me know. Look at me. And please let me know when you can see my hand, okay? Okay. 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 And can you please cover your other eye with your other hand? Thank you. Let me know. Okay. 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 All right. Now I am going to check your nose. Okay. Very good. Okay. Now I am going to have you close your eyes, and then can you smell? Okay. All right, so the olfactory cranial nerve is intact. The olfactory cranial nerve is intact. I did the optic cranial nerve is intact. And now I am going to have you, let me check your ears. Okay. Okay. There's no drainage, no excessive cerumen noted. Now I'm going to have you close your eyes, and you please let me know when and where you hear my sound. When and if you hear a sound.
Left. Right.
Okay. The vestibular cochlear cranial nerve is intact. No abnormalities noted. All right. Now I am going to place my hands on your shoulders, and don't allow me to push down. Okay. Now, can you look this way and push force against my hand? Okay. Okay. The accessory cranial nerve is intact. No abnormalities noted. All right. Now I am going to assess your lymph nodes. Okay. So we have submantle, submandibular, tonsillar, pre-auricular, post-auricular, anterior cervical, posterior cervical, occipital, supraclavicular. All lymph nodes are intact. No abnormalities noted. Do you have any pain or tenderness when I touch any of your lymph nodes?
No.
Patient denies pain and tenderness. I am now going to assess your thoracic and your lungs, okay? Can you please turn this way for me? Thank you, ma'am. Can you move your hair to the front? Okay, thank you. Now, when I place my hands on you, breathe in through your mouth, okay? Okay. 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 Now, this time when I place my hands on you, please say 99 each time.
99. 99.
Okay. The thoracic expansion is intact. No abnormalities noted. Her tactile fermentus is intact. No abnormalities noted. Okay. I'm going to place my hands here, and you let me know if you feel any pain or tenderness.
Okay. No.
Okay. Patient denies any pain or tenderness. Respirations are even and unlabored. No accessory muscles are used. Denied shortness of breath, and no cough noted. I am going to listen to your lung sounds, okay?
Mm-hmm.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16. Okay, great. Lung sounds are clear upon auscultation. No adventitious sounds heard. Okay, so now we're going to move forward, and I am going to assess your heart. And I'm going to assess your heart by listening to your heart sounds. So, right second intercostal space is the aortic valve. Left second intercostal space, the sternum border, is the pulmonic valve. Third left intercostal space is the Erb's point. Fourth intercostal space is the tricuspid valve. The fifth intercostal midclavicular space is the mitral valve. Heart sounds are normal, no abnormalities noted. Okay, so now I am going to have you lay back. Okay, abdomen is flat and non-distended, and I am going to start by listening to your bowel sounds, okay? Are you comfortable? Okay. Now we're going to start in the right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. Bowel sounds are heard times 4 quads. I'm now going to palpate. All right, so we're going to start in the right lower quadrant, the right upper quadrant. I keep wanting to do that. The left upper quadrant and the left lower quadrant. Did you feel any pain or tenderness as I palpated your stomach?
No.
Okay, great. Thank you. When was the last time you had a bowel movement?
This morning.
This morning. Good. And how about when you urinate? Do you have any pain, burning,
No.
urinary frequency? No. Color or odor?
Mm-mm.
Okay, great. Okay, so I can have you sit up for me now, ma'am. Great. Thank you. All right. So now I am going to test. I'm going to do your extremities. Okay. So you let me know if you feel any pain or tenderness. Any pain or tenderness? No. Okay. Now I'm going to do your legs. Any pain or tenderness?
No.
Okay. Patient denies pain and tenderness. There's no bumps, bruises, lesions noted. Okay, so now I'm going to do your capillary refill. Okay. And okay. Capillary refill is less than 3 seconds. It's equal on both sides. All right. So now I am going to do your strength test. Can you please do like this for me? Don't let me push. Okay? Don't let me pull. Okay? Don't let me push. Okay? Don't let me pull. Okay. Now I am going to have you stand up. And can you please walk this way 3 steps? Okay. Can you come back? Patient's gait and mobility is intact. Romberg's test is negative. Go ahead and have a seat. I am now going to check your pulses. And I will start with the carotid pulse, which I will check one at a time. Okay, carotid pulse. Okay, then we have our brachial pulse. We have our radial pulse. We have our popliteal pulse. We have our posterior tibial pulse. And we have our dorsalis pedis. Okay, all pulses are +3 bilaterally equal, strong. All right. Are you having any pain? No pain anywhere? Okay. Are you comfortable? Yes. Is there anything else I could do for you?
No.
Okay, great. So I am going to document my findings and the doctor will be in with you shortly. Thank you. Have a good day. I am going to perform hand hygiene and I will exit.